once again, welcome to Medical Ward BSN 3E, group number 1. And we're still here at Maria Reina Xavier University Hospital, Station 2B, and on a PM shift. So this is going to be our second week here in this institution for us to have our virtual duty or virtual clinical duty. And of course, this is in response to, of course, the new normal that we are actually having today. So our focus for today is all about our case analysis number 2, and our case analysis number 2 is going to be on diabetes mellitus type 2. I know you already have an information about this condition, but let us have to explore a little bit deeper your understanding, and of course for you to answer the following questions that will be raised right after the case. But before that, let me share this premise. I am here for you. It's literally my life's work to help you grow. So you help me grow, and of course, I will also help you grow also. Because of course, you want to become the angels of the sick room. So therefore, we are actually here in this institution to be that angel in the sick room. Before that, let me share with you the learning outcomes that we're going to have in this case study. On completion of this case study, student nurses will be able to build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. The fourth one is define the roles and the contribution of student nurses in the care of patients and the care of medical patients. And lastly, justify optimal therapy based on the current understanding of the case. So this is going to be the basis of our expected outcome at the end of your case analysis, because of course we'll have to evaluate how far you are in your understanding with regards to the lecture topic when it comes to this diabetes mellitus type 2. So let's proceed now to the following. Of course, this is just a recap of your instructions before. Please allow me to read this. All critical thinking questions presented within or after the case applies to the case study. You have to create a brief and to the point responses, and of course there has to be no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented, and do not assume that information that is not provided in the case. Please follow the format of your output, especially on its font style, font size, paper margin, paper size, and of course save it as PDF file and submit all your requirements per group on date specified its deadline. Of course, I have already given an information regarding how to save your or how to have your file name, especially on the files that you are going to submit, is because of course that will be for uniformity and consistency, and that will also be the base of me to evaluate whether or not you have submitted your requirements on time, or it's gonna be on a late matter or late submission of requirements. Send all your requirements via the official email address of your clinical instructor, which I will be posting later. And of course, it is advised that you will submit all your requirements on or before the set deadline of submission. Let's now have case scenario of patient EF with diabetes mellitus type 2. So patient EF is manifesting this condition, and we'll have to dig a little deeper how you're understanding or how you understand the case on diabetes mellitus type 2. EF is a 34-year-old woman from Carmen, Cagayan de Oro City, comes to the clinic of MRXUH with complaints of chronic fatigue, increased thirst, constant hunger, and frequent urination. She denies any pain, burning, or low back pain on urination. She tells you she has a vaginal yeast infection that she has treated numerous times with over-the-counter medication. She works full-time as a clerk in a loan company and states she has difficulty reading numbers and reports, resulting in her making frequent mistakes. She says, "By the time I get home and make supper for my family, then put my child to bed, I am too tired to exercise." She reports her feet hurt. They often burn or feel like there are pins in them. She has a history of gestational diabetes and reports that after her delivery, she went back to her traditional eating pattern, which is high in carbohydrates. In reviewing uh, in reviewing EF's chart, you noticed she has not been seen since the delivery of her child 6 years ago. She has gained considerable weight. Her current weight is 173 pounds. Today, her BP is 152 over 97 millimeters mercury, and a random plasma glucose is 291 milligrams per deciliter. The primary care provider suspects that EF has developed type 2 diabetes mellitus, or DM, and orders the following laboratory studies: fasting glucose of 184 milligrams per deciliter, HbA1c or your glycosylated hemoglobin of 8.8%, total cholesterol of 256 milligrams per deciliter, triglycerides of 346 milligrams per deciliter, LDL of 155 milligrams per deciliter, HDL of 32 milligrams per deciliter, urinalysis positive for glucose but negative for ketones. EF is diagnosed with type 2 diabetes mellitus. The primary care provider starts her metformin or your glucophage 500 mg and glipizide glucotrol 5 mg orally each day at breakfast, and atorvastatin or your Lipitor 20 mg orally at bedtime. She is referred to the dietitian for instructions on starting a 1,200 calorie diet using an exchange system to facilitate weight loss and lower blood glucose, cholesterol, and triglyceride levels. You are to provide education regarding pharmacotherapy and exercise. EF comments, "I've heard many people with diabetes can lose their toes or even their feet." You take this opportunity to teach her about neuropathy and foot care. High 5 critical thinking questions. Number 1. Interpret EF's laboratory results. Again, interpret EF's laboratory results. Number 2. Identify the 3 methods used to diagnose DM. Again, identify the 3 methods used to diagnose DM. Number 3. Identify 3 functions of insulin. Again, identify 3 functions of insulin. Number 4. Describe the major pathophysiologic difference between type 1 and type 2 diabetes mellitus. Again, describe the major pathophysiologic difference between type 1 and type 2 diabetes mellitus. Then lastly, what are the risk factors for type 2 DM? Place a star or asterisk next to those that EF exhibits. Again, what are the risk factors for type 2 DM? Place a star or asterisk next to those that EF exhibits. Daily duty requirements. For day 0, case scenario loading. So posting of your case will be posted on your course. Day 1, Monday. Submit a GO, SO, DPA, physical assessment, pathophysiology, drug study, nursing care plan. Day 2 for Tuesday, submit your SO, DPA, CRA day 1, sample nurses notes, FDAR of day 1 and day 2, discharge plan, reflective journal reading, and for week 1, follow the case study written requirements. Case study requirements. Of course, you'll have to have again your introduction, nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic tests, drug study, problem lists, nursing care plan, discharge plan, learning outcome, and of course your references utilizing the APA style of reference taking. Let's now have the deadline of submission. Day 1 is February 8, 2021. The deadline is until 11:59 p.m. For day 2, February 9, 2021, Tuesday, the deadline is until 11:59 p.m. And for week number 2, the deadline is February 13, 2021, and that's a Saturday, 11:59 p.m. We are all on our journey together. We are all on our journey, our own journey. But in this class, we all need one another and will help one another grow. These are my contact details, my email address, my phone number, and my social media platform. This has been Joseph Bahian Abang at your service to make your best better. Thank you so much. To God be all the glory.